Hi, this video is about benzo withdrawal and specifically how to use natural remedies to achieve two goals. The first goal is to ease and assist the tapering withdrawal process itself, to reduce the symptoms of anxiety, insomnia, agitation, and so on and so forth. And then following on from that, the second goal is to boost the natural self-healing neuroplastic ability of the brain, to speed up the recovery process in people that it's taking too long in, to hopefully, if possible, kickstart the healing process in those poor individuals that just kind of get stuck and like in a treadmill, spinning their wheels, never recovering. And then also to make the recovery more complete, to strengthen it or deepen it, so to speak, to reduce the possibility of a relapse and return of symptoms. Neuroplasticity has different meanings. In this context, I'm referring to the brain's ability to regrow lost sensitivity within the synapses and to grow brand new synapses. As you probably already know, benzos result in a loss of GABA receptor sites within the synapses, so that over a period of time, the benzos themselves become less and less effective. And then when you come off the benzos, GABA activity in the brain plummets, so that your brain is unable to control its level of activity and becomes really hyperactive. That gives all of the agitation and insomnia and shaking and even seizures if it's really serious. Now, there's a thing called synaptic plasticity, whereby a synapse can regrow and regenerate lost sensitivity, can regrow and regenerate the lost receptor sites. Another thing the brain can be stimulated to do is grow brand new synapses, that once you're off the benzos and you grow a new synapse, it's never seen a benzo before. It is a brand new, fully GABA sensitive synapse. Another thing that's happening in the benzo brain is that another neurotransmitter called glutamate, which has a stimulating effect, the opposite effect of GABA, which is sedating. And glutamate activity has become hyperactive. So what we want to do is to counteract that and hold it steady whilst the brain recovers and regenerates. My name is Peter Smith. I'm a functional medicine practitioner and I treat and coach people how to use natural remedies to improve the health of their brain and combat mental health problems. I've been using these methods to help people transition off recreational and prescription drugs, mainly benzos, since the 1990s. If you'd like to find out more information about what I do, you can visit my website, balancingbrainchemistry.co.uk, and also follow me on social media. And if you find this video useful, please give me a thumbs up or a like. The purpose of this video, and the only real part of the video I want to get to myself, is discussing how you can use natural remedies to boost neuroplasticity and ease the tapering process. I hope that you'll find that information interesting and valuable and optimistic about what you can do to help your benzo brain. But first, there's an issue I have to discuss. What I'll be discussing is apparently controversial and many people disagree with it. And there's a lot of information you can read online where people say that you shouldn't use natural remedies or there's nothing you can do to boost neuroplasticity. So I want to discuss that or share with you why I believe that's a myth. I'll break it down into three issues. The first issue is that some people suggest that the natural remedies, the herbs with anti-anxiety GABAergic effects, must be attaching to the GABA receptor sites in the same way that the benzo drugs are attaching to the GABA receptor sites. And we know that the way benzo drugs do this is bad. It causes a loss of receptor sites and it causes dependency and then horrible withdrawals and other things. So people are saying, well, we shouldn't be using anything that attaches to GABA receptor sites because it must be harmful, like benzo drugs, and you're only either creating another problem or at best you're just delaying the problem, kicking it down the road, so to speak, and you're still going to have to face it at the end when you come off the herbs and natural remedies. Now that's a totally legitimate and valid question, but it turns out the natural remedies do not behave like the benzos. They don't attach to the GABA receptor sites in the same way and cause desensitization to GABA, nor do they cause an upregulation of glutamate activity. I'll give you two ways that I came to that understanding. The first thing is my clinical observations treating benzo brains using natural remedies since the 1990s. And the second thing is what the science is telling us. In the 1990s, before the internet even existed and there was any forums discussing these hypothetical possibilities, I was already using natural remedies for people with benzo brains. All I knew back then was, well, GABA levels are going to drop, so I'm going to ease that process with the herbs. And I'd been trained and led to believe that the herbs have generalized, complex healing processes. But I trusted what I'd been taught. I applied it, and people would use the natural remedies to smooth the transition. Then they were off the benzos. They were now relying upon the natural remedies. It wasn't a completely smooth transition. I mean, there was still some pain and suffering, but it was mitigated and reduced by the natural remedies. And then people were standing like as a sort of stepping stone on the natural remedies only, without the drug. If there was a prior existing anxiety issue at that time, I would be getting people to use psychotherapies and exposure therapies and all kinds of different things to address the pre-existing anxiety. I do know that not everybody was put onto benzos in the first place for anxiety. It might have been for insomnia or so forth. But then whatever it was, while we were on the herbs, off the drugs, we worked on the prior existing issues. And then this is the important point. In the fullness of time, it might be as much as a year or even more down the road, people could then just transition off the herbs, and there was no evidence whatsoever, no signs or indication that these herbs were causing a withdrawal phenomenon like the benzo drugs. And here's another fact. Not only was I doing that with benzos, but I did the same with people coming off other drugs like cocaine and meth and crystal and so on and so forth, where I'd be flooding the brain with dopaminergic remedies, because that's what those drugs primarily work on, and you get a drop in dopamine levels. And then people would be off the drugs, on the natural remedies, and then in the fullness of time, perhaps once they'd done some other work, some therapy on their addictive personality and some drug counseling work, they could then just transition off the herbs. And again, there was no evidence of dependency. And another experience was I had bipolar disorder, and I've sometimes, for as much as 2 years at a stretch, I was taking dopaminergic boosting remedies. When I tried to stop taking them, if the depression hadn't cleared, it would come back. But that's not the same as me being dependent upon the herbs. Once I eventually had sort of overcome or resolved that current phase of depression, I could then just transition off the remedies. And there was no dependency, there was no sudden drop. You might say, did I see enough patients? Were the people that I saw just the lucky ones? Well, I don't think so, because my job is actually being observant what's going on in my patients and also in myself. And I think these remedies either do cause dependency or they don't. And I would see it, or at least there would be some hint of it. And there literally wasn't any. All I want to do here is just share my experiences, and if that's an alternative view to what you've read, then that's what it is. I'm not attempting to provoke an argument with you. If you want to believe that the remedies do that, then, well, I'm sorry to hear that. And actually, while I'm here, could I just make a quick appeal? I'm very much interested in people's comments, and I encourage you to share your stories, but would you please keep it polite? Because I've had some people on social media be appallingly rude to me. And you know, I'm just going to delete those posts. You can't talk to people like that and hide behind the anonymity. So say what you've got to say in a respectful and nice way, and we'll have a discussion. Let's not forget that we've actually got something in common here. We've got common shared ground and common shared goals. We're both interested in how to restore health to benzo-damaged brains. Now, moving beyond my personal observations, is there any scientific evidence that these natural remedies desensitize the brain to GABA or upregulate glutamate in the same way that benzo drugs do, and therefore we should avoid them? And to illustrate this, I'll pick just one remedy. We'll choose chamomile. The main active ingredient in chamomile is called apigenin. Now, you don't get very much apigenin in just a single cup of chamomile tea. It's going to take a bit more than that. But let's look at what apigenin does. Investigations into apigenin showed that it definitely does not attach to the GABA receptor site in the same place or the same way that the benzo drugs do. This was proven by apigenin's effects were shown to continue even when it was mixed with a drug that is known to block the place where benzo drugs attach. You give this drug with a benzo, the benzo drug doesn't work. You give this drug with apigenin, the apigenin still does work. That's already, I think, enough to kind of disprove the case. But there's much more. Apigenin also has effects of dampening down excessive glutamate activity in the benzo brain, which is exactly what you want. Apigenin has anti-inflammatory effects. Again, another thing that you want. It boosts BDNF and neuroplasticity. BDNF is a chemical that's involved in stimulating neuroplastic growth and development in the brain. In fact, reducing inflammation and boosting neuroplasticity is kind of, if I had to sum it up in a nutshell, that's the basis of the treatment I use to heal the benzo brain, to speed up the recovery process. But apigenin does even more than that. It has proven effects at enhancing sleep. Most regeneration in the brain and neuroplastic change in the brain occurs while you sleep. Not only do you need sleep to kind of just feel better or not feel crap the next day, you need it for healing the brain. Another effect of apigenin is that it dampens down overactivity in the stress response in the body, the hypothalamus pituitary adrenal axis. And if that system is overactive, which it often is in an agitated and anxious brain, that can spew out excess cortisol, which can disturb sleep and ramp up inflammation and may attack key structures in the brain that result in depression, if that's a feature of your condition. Another thing apigenin does is it increases the turnover rate of norepinephrine and dopamine inside the amygdala and reduces or dampens down the reactivity of the amygdala. And in the anxious brain, you have a hyperreactive amygdala. Apigenin also has a serotonergic effect. Serotonin enhancing effect is antidepressant, anti-anxiety, sleep enhancing. Let me just sum that up to really nail this point. Benzo drugs, on the one hand, have no neuroprotective effects. They can damage the GABA receptor sites or sensitivity of the synapses to GABA and upregulate glutamate activity, leaving the brain in a hyperactive, agitated state. Apigenin does not attach to the GABA receptor sites in the same way. It downregulates glutamate and has multiple neuroprotective effects. Now, I know I get very kind of excited and enthusiastic about the therapeutic and wonderful effects of plants and natural remedies. Don't get me wrong, I'm not saying that anybody has ever cured their benzo brain by just taking apigenin or drinking some chamomile tea, for goodness sake. You know, it takes a lot more than that. Look, while I'm here, why don't I give you an extra little bonus tip? If you're having a problem with sleep and you're coming off benzos, combine these three herbs together. Apigenin, and you're going to take that in the form of chamomile. Drink some real whole chamomile. I recommend loose leaf, stewed, strong brew, rather than just the tea bags, because it's not good quality in the bags and it's not very strong. But if you have to get the bags, put 2 of them in. And then in addition to taking the raw whole herb, take an actual chamomile supplement that has a higher level or standardized concentrated level of the apigenin. Put those 2 together, that's 1. Combine that with magnolia bark, with melissa or lemon balm. It's a little difficult to get magnolia bark. You're going to need to buy it ideally in a concentrated powder from a reputable Chinese herbal medicine supplier. These 3 things stacked together have really wonderful sleep enhancing and hypnotic effects. I hope that helps. Now for the second issue that you'll read in benzo forums. You'll see people saying that they've had bad reactions and side effects to the natural remedies, and that's a reason why you should avoid them. Well, I'm going to argue that if you properly use the natural remedies, you can avoid and control those side effects. Inside the benzo brain, you've got diminished GABA activity, which means you have a reduced ability to control excess excitability. You also have increased glutamate activity, which means that you've got inherently revved up excitability. Now, if you come along with a remedy which has any stimulatory effect, it may not be its primary action. Stimulation may not be its primary action, but it might initially cause some increased activity. In this brain, that's going to result in hyperactivity and very uncomfortable feelings and intensified distress. You could, whatever you've got, whether it's anxiety, that could become intensified. If it's headaches, that could be insomnia, and so on and so forth. There are stories being swapped in benzo forums about magnesium being a problem and B vitamins being too stimulating and vitamin D being too stimulating. Well, now hang on a minute. Magnesium can be an effective anti-anxiety medication and enhance sleep. It has multiple effects. It's involved in over 300 enzyme systems, which is a lot. Now, magnesium deficiency is actually surprisingly common. You might be magnesium deficient. And what will happen, imagine inside your cells, you've got 300 enzyme systems all competing for limited availability of magnesium. So if I'm an enzyme that needs magnesium, and then, oh great, there comes along a magnesium, I'll grab that and I'll do my thing. Oh, and then I've lost it again and the next enzyme has grabbed it. We're all competing for limited availability. Now imagine that you take a magnesium supplement, satisfy all of those systems. They're all going to suddenly en masse fire up activity. Some of them are detoxifying systems, so you're actually going to be dumping toxins. Some of them are cellular energy manufacturing systems, and so you're going to increase more cellular energy, including the cellular energy inside your neurons, manufacturing neurotransmitters, and so on and so forth. So yes, if you're magnesium deficient and you put in magnesium, especially if you put in quite a lot quite quickly, anybody could have a pretty strong reaction. If the person was suffering from chronic fatigue syndrome and a lack of energy, they might really welcome that increased cellular energy. But in a benzo brain, where you've got this lack of inhibition and overexcitability and you put more energy into the system, yeah, it's probably going to feel very uncomfortable. Now, should that mean that you don't supplement magnesium? Hell no, it doesn't mean that at all. In fact, let me put it really strongly. If you are deficient of magnesium and deficient of B vitamins and deficient of vitamin D, I don't see any way ever that you're going to recover your benzo brain. That would be like trying to build a house without supplying building materials. These things are necessary building materials. So it is not an option to avoid supplementing those things if you are deficient. What if you're not deficient and you just want to have sort of enhanced magnesium, B and vitamin D activity in the brain, which is often how I use supplements? Then you might say, well, but aren't you revving the brain up? Just a few days ago, a new patient I'm seeing for benzo recovery told me about a horror story he'd read about someone that had taken B vitamins and had an awful reaction to it. And then he happened to mention that they had B vitamin infusions. I was like, whoa. B vitamin infusions? That is a lot of B vitamins in too short a period of time. That's not something you would do to a benzo brain. If you gave me right now a B vitamin infusion, it could give me so much energy, it might actually flip me up into mania because I have bipolar disorder. I'd probably be hypomanic for 48 hours or something. That's not how you would introduce B vitamins into a B deficient benzo brain. You would drip feed them in small amounts. And if you accept that you've got to take those things in order to recover, how are you going to do that? Two strategies. One is obviously put them in very slowly, but the other is combine them with things that have GABAergic effects and anti-glutamate effects so that you're assisting the brain to control its level of stimulation and activity, then adding these supplements in. That's the way to do it. Although I am a great fan and advocate of self-help therapy, unfortunately, if you don't know what you're doing, then you might not take remedies in the right combination. One of the things that I see happening a lot is that people take remedies on their own. They might just try just magnesium or just one B vitamin, and you never take a B vitamin on its own without taking a B complex. If you want to take a high dose of an individual B vitamin, like B12 or B6, you take a B complex as a foundation, and then you stack up the individual ones on top of that. Also, I wouldn't actually supplement magnesium without B vitamins, because the two sort of go together. You have to take these things in combination. Now, this need to take remedies in combination, unfortunately, presents a very big challenge for most people with anxiety and benzo brains. You know that your brain is programmed to be hyper vigilant about what could go wrong and potential threats. And time again, my patients say to me, oh, this is too many remedies to take. I don't know what's doing what, and what about interactions? And as I explained, you actually get less side effects and less interaction problems if you take a more comprehensive program or combination. But I totally understand that that's not how it feels. Did you know that the GABA receptor sites are mainly concentrated in parts of the brain, such as the amygdala, involved in fear responses and threat detection, so that when you withdraw benzos and GABA activity in the brain plummets, it's those systems that rely on high levels of GABA activity that are the most effective. So as GABA activity plummets when you come off benzos, those systems in the brain fire up into hyperactivity, making you fearful and anxious. If you put a page and it had 50% of the information on the page said, oh, this thing is okay, but 50% said, well, we're not sure it's okay, or there's possibly some side effects. The anxious brain is going to ignore the side that says it's okay and only pick out the bad information, compared to an optimist who would actually do the opposite. Or if you had depression, which I've had a lot of, and depression distorts your brain in a different way, it's not so much that you would be afraid of things going wrong, but you would just think, oh, well, yeah, but they would just go wrong for me. Because the depressed brain is locked into a hopeless state of mind. And something I'd like to add to this, it's a little bit off topic, but I hope you get something valuable from it, is, really try to be very careful with what you do online when you've got a brain that is hyper vigilant for looking for what could go wrong and threat detection. It's actually a little bit scary how good Google's algorithm, and the same on Facebook and YouTube, the algorithm search engines, can identify your patterns of behavior, your subconscious patterns of behavior, and what you are looking for. They know that better than you do. I'm not saying they can read my conscious thoughts. I have independent conscious thoughts. But for sure, Google knows my subconscious actual behaviors, what I'm really going to look for. But better than I do. I know I go online thinking, and you probably did the same, thinking, oh no, I'm going to look for the information I want and I'm going to pick and choose. But that's not what's happening at all. As soon as you start putting in search terms, pretty quickly Google locks onto what you're looking for and only directs you to sites that have that information. Even if you try to sort of break out of your way of thinking and said, well, I'm going to look for recovery from benzos is really easy, Google might just throw up on the side, do you want to read about how it's not easy? You might say, I'm going to search for natural remedies are completely safe. There are no side effects. This thing is good. Google's going to just pop up on the side there. Yeah, would you like to see something about how it's not good, not safe, difficult, challenging, bad, dangerous? And you click on those things a couple of times, then the algorithm will figure out what you're looking for. On the one hand, there's a great deal of benefit in the community support and realizing that you're not alone with these problems. But I'm suggesting that you think carefully about how do you feel when you go into these forums, or rather when you leave the forum, how do you feel? Are you feeling more optimistic or pessimistic about your future? Have you learnt some useful ways of expanding your options? Or have you actually ended up being made more afraid and contracted into a limited range of options? I felt that I wanted to say that because it does pertain to one of the challenging aspects about recovering from benzos is trying new things, and the other one is trying them in sufficient combinations to have a balanced prescription. And I hope you found something useful there. Something I should have said before was, when you read these stories about people having side effects, you rarely get an explanation about the rest of the things that they're doing and the rest of the things that are going on. I've had strangers write to me asking me questions about side effects, and when I got into a discussion with them, I found that, for example, they were eating a terrible diet and were chronically dehydrated when they were taking a lot of supplements. Well, that's definitely going to give you some bad effects and headaches. Moving on now to the third issue. You may have been led to believe by what you've read that there is nothing you can do to speed up the recovery process. That just hang on in there, get support and tough it out and wait. But I don't agree with that at all. I can't explain because I can't really understand why the information that's online is still so, well, frankly, out of date. There has been major breakthroughs in our understanding of how to boost neuroplasticity and regrow brain structures since about 2012. I'm making this video January 2020. That's 8 years ago. I began researching neuroplasticity in 2011, and it was really out of desperation because I was suffering from quite serious and rather rapid decline in brain function, which wasn't funny at all. It was probably the result of having had bipolar disorder poorly managed for many years. Sometime before that, I, 2012, put together my own treatment program to boost neuroplasticity and BDNF production, decrease inflammation, and eliminate anything else that I could think of that was impeding neuroplasticity. And the results were absolutely phenomenal. I more than reversed the decline I had and ended up in some areas of my brain being better than I had ever been. Then just a few months after that, Dr. Dale Bredesen published his work. I'd never heard of his work before. He'd been researching and developing ways of boosting neuroplasticity in the aging brain. He took 11 people with early stage Alzheimer's disease and reversed it in 9 of them. I mean, that's really significant. And since that small scale published trial in 2012, he's gone on to treat several hundred people with a continued remarkable success rate. And also in my practice, since that time, I've treated several hundred people using these methods. Although I'm just a frontline functional medicine practitioner, not a research scientist doing controlled trials and publishing scientific papers like he is. And today his work is still hardly known about. What fascinated me was that, well, pretty much 90% of what he did in his program, I was sort of doing in mine. And then 2013, Dr. Ditas Karazian published his book, Why Isn't My Brain Working?, in which he discusses neuroplasticity and the conditions that you need to create within the brain to grow and support healthy neurons. And again, 90% of what he was saying in there was the same as what I had done in my program and worked out for myself, and what Dr. Dale Bredesen was saying in his program. So it's become apparent that if you fulfill a few key elements, actually when I say a few, Dr. Dale Bredesen discusses 36 parameters that have to be checked and made okay in order to regrow the brain. Once you fulfill the requirements of the brain and eliminate the things that are holding it back, brains have extraordinary capacities for self-repair. I'm going to say that the brain is the second most repairable part of the human body, second only to the liver. I waited a year after doing the successful treatment on myself before I rolled it out into my practice, and I totally explained to the first patient I did this with that I had only ever done this treatment protocol once before, and that was on myself, so I was guinea pig number 1, and if they chose to do it, then they would be guinea pig number 2. They jumped at it, they said, yes, I want to try that, and their story was not unrelated to benzo brains actually. They were on antidepressants. Now I don't know if you know this, but some people suffer terrible side effects, not everybody, but some people suffer terrible side effects coming off antidepressants. It's now becoming an acknowledged issue. Not perhaps as common as benzos, but certainly for the people who have it, it's really serious. And this person was having that phenomenon. And the neuroplasticity treatment that I did with them was unlike anything I had seen before. I had done drug recovery and benzo recovery in many people in the 90s and noughties, and there it was, 2013, and this treatment just worked straight out of the box. This is the book by Dr. Dale Bredesen, The End to Alzheimer's Disease, and this is the book by Dr. Karazian, Why Isn't My Brain Working, that I highly recommend you get and read. Now let me just reiterate something that I've said elsewhere, but I don't want to ever sound like I'm selling snake oil here. The neuroplasticity boosting treatment that I'm talking about is not a miracle cure. It's not going to work for everybody. It's not going to instantaneously stop the pain and suffering that you're having. But I genuinely believe that it can help some people. It's helped me, it's helped some of my patients, Dr. Karazian's patients, and Dr. Dale Bredesen's patients. Okay, so I'd like to wrap up that section now and move on to the treatment section. I hope that what I've just said answered some of your questions and concerns, and I'm sure you'll have more. Put them in the comments. I'll try to answer them as best I can. I'm not promising that I can catch every question and throw back a good answer. It can't be like, me versus the entire internet. All I can do is just share my clinical experiences, and I hope that that's helpful to you. So this is a summary of the techniques and important principles that I follow when assisting people through a benzo withdrawal and recovery. There are three overarching components to always keep in mind. The first is eliminate anything and everything that is undermining neuroplasticity. Things like inflammation, toxins in the brain like mercury that shouldn't be there, nitrosative stress, oxidative stress. Eliminate these things. The second thing is any remedies or treatment techniques you introduce to the benzo brain must have an overriding neuroprotective, underline that word, keep it in your mind, neuroprotective effect. You can't introduce something that is just stimulating to the benzo brain and hope that it will get stronger in the way that a healthy brain would get stronger from stimulation, promoting neuroplasticity. The benzo brain has to be given things that are neuroprotective to upregulate neuroplasticity. So neuroprotective. The third overriding principle is that the treatment overall, especially in the beginning, should assist the brain to control its level of excitation. The benzo brain has too little GABA to put the brakes on it and too much glutamate flooding the engine, so to speak, with too much gas. So it has a tendency to speed up. And you have to help the benzo brain to control that tendency to speed up as you introduce and roll out new treatments. So three principles, keep those in mind. Now, going into more detail on that first point of eliminating anything and everything that is undermining your neuroplasticity. Now, if I could ask you to really pay attention to this, because something I really struggle with in my practice is to get people to take this part of the work seriously enough. Everybody wants to just get to how do I boost neuroplasticity and boost BDNF production, and they want to kind of miss this step out. The first thing to do is eliminate anything and everything that's undermining your neuroplasticity. It's a mistake to think of this first part of the treatment as just some sort of inconvenient step that you have to get over and get out of the way as quickly as possible before you can get to, the good bit, boosting the neuroplasticity. If you just go straight to boosting neuroplasticity and BDNF and you leave in place things that are undermining your neuroplasticity, firstly, your treatment's going to be very inefficient. In fact, it might be so inefficient that you don't really make any progress. Let's say even if you did make some progress, it would take longer and it would be less thorough or complete. Your brain would be less completely healed and therefore more vulnerable to a relapse down the road. Also, the neuroplasticity BDNF boosting remedies are not cheap, and if you're on a budget, you want to get the most out of them. So you have to do this first step. Furthermore, and this is a really important point, so please don't miss this, eliminating the things that are undermining your neuroplasticity may be treating the very reason why you are in this situation in the first place. I mean to say, what is it about your brain that made it so particularly vulnerable to the effects of the benzos that you went and developed a benzo brain, and then it has been so slow at recovering and recuperating that you're still watching this video at this point. I know this has happened to an awful lot of people because these drugs are very destructive, and so it's quite a common thing. But the point is, there are these other people who take benzos and they actually don't have such a bad effect, and they recover quite quickly. What is going on in their brain that you can try to emulate and get going on inside your brain so that you can recover? They have great neuroprotective abilities in their brain in the first place, and super neuroplastic abilities to repair their brain following on from that. And they will have low levels, or at least insignificant levels, of those factors like inflammation and toxicity that can undermine neuroplasticity. So you want to get into their zone. And following on from your recovery, which hopefully you're going to make, you want to keep yourself in that zone where you've got a greater capacity for neuroprotection and neuroplasticity than you have undermining elements, so that you can keep your brain healthy for a long life of good performance and avoid cognitive decline and Alzheimer's disease. Now, there are many things that can undermine your neuroplasticity. In his work with the aging and Alzheimer's brain, Dr. Bredesen has identified 36 individual parameters, any one of which can be responsible for undermining neuroplasticity. I, however, use a simpler and certainly a lot cheaper system. You don't have to do so many tests. And I've also adapted the system to suit the needs of the benzo brain. Dr. Bredesen's working with Alzheimer's patients and the aging brain, and you have to modify the technique to suit the needs of the brain you're working with. Now, whether you're still on the benzos or you've already withdrawn from them, you should just get stuck straight into reducing the things that undermine neuroplasticity. However, if you haven't yet started withdrawing and tapering off the benzos, you might want to consider spending a few weeks eliminating the things that undermine neuroplasticity before you even begin the taper. Let's say, for example, a person has a small intestine bacterial overgrowth causing a lot of inflammation in their system. I'm going to recommend that people don't start the taper until we've cleaned that up, because doing so is going to pave the way for improved neuroplasticity and an easier, quicker tapering. So what are the main things that undermine neuroplasticity that you should really be concerned with? Well, one thing stands out head and shoulders above everything else as being destructive for neuroplasticity, and it's inflammation in the brain, or neuroinflammation. Now, you might have an understanding of inflammation as something quite sort of severe, when something is like swollen and red and sore, and that's what inflammation is, or you have a whole body fever and that's what inflammation is. So you might think, well, I don't see any symptoms of that, so I don't think I have inflammation in my brain. But I'm not talking about that degree or level of inflammation. There's lots of research now that people with mental health problems and people with poor neuroplasticity have a slightly elevated level of inflammation hidden in the background. So you don't know you've got it, you can't really see it, it's hidden, you don't feel it, but it's chipping away at your neuroplasticity. And it's so critically important to get rid of it, to make progress, that even if you went and had a blood test and the blood test came back showing no big evidence for inflammation, I would literally ignore that blood test and still go ahead and do anything and everything that you can to eliminate inflammation. If the test was wrong and you leave behind some untreated source of inflammation, you're going to shut down the treatment. The only sure and safe way to proceed is to presume that you've got hidden sources of inflammation and eliminate them. Okay, let's get into my favorite bit, which is going into more detail on the actual treatment. What you want to know is, where does all of this inflammation come from in the first place, and how do you get rid of it? Now, just for the sake of simplicity, I'm going to describe the main sources of inflammation from top to bottom, literally from the brain to the large intestines. Number one, the mind itself can be a source of inflammation. The way it works is, stressful psychology and traumatic memories trigger stress responses in the body, The mind communicates these responses via the autonomic nervous system, and the hormonal route is the hypothalamus pituitary adrenal pathway, which ends up releasing excess cortisol. And the effect of this is to create inflammation and inflammatory chemicals called cytokines in the body, which then can travel into the brain and push up levels of inflammation in the brain. So it's from the mind to the body and back into the brain. And you can start combating this source of inflammation straight away. You can do deep relaxation brain training exercises to teach your body how to switch from a fight, flight or freeze sympathetic dominant state in your nervous system into a relaxation and restore parasympathetic dominant state in your nervous system. And in the same exercise, you can teach your brain to switch off overactivity in the hypothalamus pituitary adrenal HPA axis, releasing excess cortisol. The exercise to do this is actually a very simple exercise. What makes it therapeutic is the intensity and number of hours that you have to do. To hardwire the ability to throw those switches in your brain takes at least 50 hours of brain training. That would be 30 minutes a day for 100 days. That's only 3 months and 1 week. The problem a lot of you are going to have is that you couldn't do 30 minutes of deep relaxation in the very beginning in 1 day because your brain is in such a hyper-agitated state. And I do understand that problem. Look, if you can't do 30 minutes, if you can only do 3 minutes, that's where you've got to start. You've got to make a start somewhere. And the great thing is, quite quickly with practice, you find that you can do longer and longer sessions. Now, as a bonus to you, if you're still watching this video at this point, I'm very grateful to you and I appreciate your time. I'll give you a free MP3 recording with some written instructions as to how to do that brain training. All you have to do to get your free copy is go to my website. On the front page, there's my email address. Email me, ask me for the free relaxation MP3 recording, and I'll send you a copy. Now, something I'll add to this is, in addition to just teaching your brain to throw a switch, if you have a lot of stressful psychology programmed into your way of thinking, traumatic memories stored in your hippocampus, and traumatic trigger responses programmed into your amygdala, then in the long run, to make your brain stronger and more resilient to stress, less likely to have stress-induced inflammation undermining your neuroplasticity, what you're going to want to do is to work with different types of therapists and actually meditation. With meditation, you can shrink an overactive amygdala and strengthen the hippocampus and cortex and change the level of connections between the cortex and the amygdala. That's already an improvement. Then you can work, if you've got traumatic memories and trauma programmed into the amygdala, work with a therapist that specializes in PTSD. And also for memories, you go back doing sort of like regression type time regression therapies where you go back to the memories and you remodel how you feel about them so that the next time your mind accesses those memories, it responds to them in a different way. You can't change the past, but what you can change is what happens when your mind spontaneously accesses and reaccesses that memory or those memories. How much of the past stress and trauma are you bringing into the present day? That can be changed. And then the other thing you can do where you would use more cognitive-based therapies like cognitive behavioral therapy is when you've got programmed stressful psychology, stressful ways of thinking, negative ways of thinking that would benefit from being challenged cognitively with a CBT therapist. But if you have a benzo brain, I recommend that you kick that down the road because sorting that stuff out while you're still in the middle of being activated and reactivated by depressed GABA levels and excess glutamate levels it's just kind of not the right time. Psychotherapy should be done within a brain that's in a relatively good state of chemical and physiological balance. Next, moving downwards, another place where you can have inflammation undermining your neuroplasticity is inside the sinuses. It's actually not uncommon for people to have recurrent or chronic sinus infections. I used to have them myself. And any bacterial infection, if you know there's anywhere in your body that's got carrying a chronic ongoing infection, you have to get rid of that infection. Infections really ramp up inflammation in the body. In my case, I got rid of my recurrent sinus infections with 2 simple steps. I got dairy out of my diet. It's sad because I used to rather enjoy it, but it used to produce a lot of mucus in my system, which was a great breeding ground for the bacteria. And the second thing I did was I used what's called a neti pot, which is a sinus wash technique with warmish, salty water in there. I used to put all sorts of other stuff in there, like propolis and so forth, but be really careful with that. I did actually burn my sinuses a couple of times. I did that actually daily for a while, and then it was just a few times a week, and then maybe once a week, and then every few weeks, and now I don't really ever have to do it. I haven't had a sinus infection in years. Another thing which you may or may not know is if you live in an environment where there is any dampness, if you have a damp house or apartment, and there's a corner that has sort of black mold coming through the paintwork. Quite a lot of molds are really quite toxic, and the spores from them can get in your nose and trigger inflammation in the brain. It's one of the tests that Dr. Bredesen does, actually. He takes a nasal swab and tests for mold spores in the nose. If you have black mold anywhere in your living area, get rid of it. You can get HEPA air filters that kill mold spores, and there's other various types of air filters. There's something called an air-free air filter, which sucks the air through and fries mold spores. You've absolutely got to clear that up. You won't make progress with your neuroplasticity if you're living, particularly sleeping, in an environment with toxic mold spores. Moving down from the sinuses, the next significant source of inflammation that you should consider is your gums and teeth. These can actually be surprisingly significant sources of inflammation. A chronic standing infection underneath a tooth can seriously downgrade your overall health, including the health of the brain. Now, you'll see online some debate and different opinions about how you should manage an infection underneath a tooth. The dentist will say, well, we'll try for a root canal treatment. But some people say, oh no, I've had a terrible experience from having a root canal and you should never have them. I'll share with you my advice and opinion. The first thing is, if you need a root canal, you make sure that you go to a dentist that specializes 100% in doing root canals. That's all they do. They are a specialist in this because you want to have a really good quality job done. It works like this. When infection has gotten right down into the root of a tooth, into the bone, I don't know if you can see that very well, but that's an illustration of it. What a dentist has to do is drill this canal wider on both sides, and that's a skilled job to start with. And then they have to fill it with cement, and they have to push in so much cement that the cement sort of comes out the bottom, fills all the way down to the bottom, no little pockets left there. And it's not shown in this diagram, but there are little side canals that pass through the dentine here, and the cement has to be pushed in under sufficient force to fill out all of those little side canals. If it only partially fills the side canal, you end up with this sort of vacuum, this kind of like pocket space where bacteria can live, and it can sort of hide inside the tooth and go into the bone, and the immune system is unable to clean out those pockets, so you've got this permanent standing infection inside the tooth. You might be able to spot it. You might get pain or swelling to the side in the gum. If you suspect that you've got that, if you go to a really good specialist, you might be able to have it redone, but generally not. What you should probably do is have the tooth pulled out, and also as the tooth is pulled out, the dentist should really drill away any pockets of infected bone. So they've got to drill right down into that, and then either the bone's going to grow back or you can have a bone graft, and you can consider, again, you must go to a specialist, having a titanium screw put in and a false tooth capped on the top, a titanium implant. If these things are done well and your bone's in good condition and your health is in good condition, and I would improve your health before you even had this treatment done, then you can get away with a well done root canal, can live inside you for as much as 20 years without causing any pockets of inflammation. But a badly done root canal treatment is going to leave a pocket of septic infection inside your skull that's triggering inflammation and impeding your neuroplasticity, get rid of it. The other source of inflammation arising from the mouth is from the gums. So go to your oral hygienist and ask them if there's any evidence of gingivitis or periodontal gum disease. And if there is, you take that really seriously if you want to reduce inflammation so that you can improve your neuroplasticity and speed up your recovery from benzos. You can actually take a look yourself in the mirror, and there's probably YouTube videos telling you how to look at gums. Your gums should be pink all the way down. If there's very red gums, or if the margin where the gum and the tooth meet is red, that's an indication of some gum disease, of bacterial growth building up. Again, we're talking about bacterial infection standing in a part of the body, triggering inflammatory responses. You must follow the advice of the oral hygienist, flossing and so forth. However, what's really interesting and surprising is that a change in diet has been shown to have a bigger effect on gum health and reducing periodontal gum disease and gingivitis than changes in oral hygiene. Obviously, I'm not saying you shouldn't floss, but in one study I read, following a high fiber, low saturated fat diet reduced inflammation in the gums by as much as 75% without any change in oral hygiene practices. And lastly, if you do have any issues with your gum health, then there's a superfood for gum health, and that is tomatoes. You need to eat a lot of them though. We're talking about 2 teaspoons of the tomato puree. What I'd recommend would be on a daily basis. Why don't you make a red onion, sweet potato soup with a lot of tomatoes in there and a couple of teaspoons of tomato puree, and that's every day. You'll see that'll have effect on the level of inflammation in your gums. Your oral hygienist will be happy the next time you go back and see them. And the 2 super supplements for gum health is vitamin C, but you might just get that from your diet. And the other one is coenzyme Q10, but coenzyme Q10 stimulates cellular energy, and in the benzo brain that might rev things up. So you might not be able to access the benefits of coenzyme Q10 at this stage. One last important thing to say about combating gum disease, but actually for everybody wanting to boost neuroplasticity. You will be probably familiar with the understanding that we now have friendly bacteria in colonies called microbiota living in different parts of our body. There's some in our colon and on our skin. Well, we now know that there is a colony of bacteria that live in the crypts, little, quite deep pockets in our tongue, and they're actually very important. They convert the nitrates in our diet, especially in root vegetables, most notably in beets or beetroot, whatever you call them, convert the nitrates into nitrous oxide, and this has a significant boosting effect on our neuroplasticity. I read a study where they compared seniors doing, it was either strength training or aerobic exercises, I forget, but anyway, doing exercise. One group was given actual beetroot concentrate, and the other was given a sort of a sham, a placebo, which was a red drink. And then they did their exercises. Actually, they took the beetroot just before the exercise, and then they were tested to see the effect on their cognitive performance as a measure of their neuroplasticity, and the group getting the nitrate-rich beetroot juice showed significant improvement in their cognitive performance and neuroplasticity. And antibacterial mouthwashes kill these bacteria. I've read a study that showed a significant, really significant increase in the risk of developing type 2 diabetes in people that used antibacterial mouthwashes once a day, and then in people who used it twice a day, which is not an uncommon practice, there was an even much higher risk of developing type 2 diabetes. If you want to tap into the neuroplasticity boosting effect of these bacteria, what you do is drink a smoothie containing beets to get that biggest hit of nitrates. Swish each mouthful of the smoothie in your mouth before you swallow it to mix it with the bacteria, and then do some vigorous aerobic or HIIT exercises. There's actually a super cool thing happening in your body if you're interested. After you've eaten one of these nitrate-rich meals, the body pumps the nitrate that hasn't been converted into nitrous oxide by the oral bacteria back into the salivary glands and then over the tongue again, and then you end up swallowing it. It gives it like a second shot. And here's another little tip you can do. Take some oral probiotics. Instead of just swallowing probiotics to go down into the colon, there are now specifically made oral probiotics. Here's one I've tried called ProDent. It's quite a refreshing, minty product, and it contains, if you are going to use one of these, I recommend getting one that contains a bacteria called Lactobacillus reuteri. I'm getting ahead of myself, but L. reuteri is something you want living in your colon because it produces GABA, which passes up the vagus nerve and has a stress moderating, sleep enhancing effect. But you can also take it in your oral probiotics. Okay, that's the mouth. Moving on down to the throat. Chronic recurrent throat infections are something you have to get rid of. There's some pretty solid evidence actually that significant recurrent strep throat infections can create so much inflammation that it can actually act as a trigger for, well, they must be pre-existing, but act as a trigger for mental health problems, most notably OCD. I know it sounds really bizarre, and I've seen it in my practice where people have been, it's usually teenagers going along and they were okay, maybe a bit of a nervy kid, and then they had lots of chronic throat infections, strep throat, which created such a level of inflammation that it changed their brain, triggered the OCD. If your tonsils or adenoids have been so infected for such a long period of time that they're actually necrotic or rotten, sorry, but you've got to take them out. If you don't have to take them out, you can use, there's actually again oral bacteria that are focused particularly, strains of bacteria focused particularly at the throat. Use those, gargling salt water, zinc lozenges, other techniques, just generally boosting your immune system. But you've got to sort that out. Moving down the body, another area that can be a significant source of inflammation in the body is chest infections, chronic chest infections. I couldn't count the number of times that I've seen people in my practice for mental health problems, and they said, oh, well, no, I have good physical health, except I have chest infections maybe 3 or 4 times a year. And I'm thinking, you know that 3 or 4 chest infections a year may mean that it's actually the same chest infection, just sometimes it flares up and sometimes it sort of goes into a more dormant state, and you've possibly got continuous year-round background inflammation provoked in your system coming from bacterial infections in your chest. Oh, and some of those people then had to take antibiotics several times a year, which then would kill out the friendly bacteria in their intestines, and they weren't aggressively repopulating their intestines, resulting in another source of inflammation. Sorry to tell you, but clearing up a chronic chest infection can be really tough and challenging. I've had a few in my life, and it takes ages, and you think they've gone, and then you stop the treatment, and then a month later, oh no, it's still there, and it comes back. You really, if you have chest infections, take it seriously and pull out all the stops. Do absolutely everything you can do to maximize your immune system, to get your immune system to get inside there and clean out that infection. One of the things you want to do to maximize your immune system is something I mentioned earlier. Decreasing overactivity in your HPA axis can have a significant effect on improving immunity. Chronic excessive cortisol production eventually results in a weaker immune system. It actually even can alter the size of the immune tissues, such as the spleen and the bone marrow and so forth. So do the deep relaxation, brain training, and anything and everything else that you can do to maximize your immune system. I've got an old mind map chart I wrote many years ago on maximizing immunity. I'd probably like to update it, but I don't mind if you want to get a copy of that again. You could email me for it. It's the Maximum Immunity PDF. If you say that, I'll know what you mean. Okay, continuing our journey down from the chest to the small intestines should be squeaky clean. There should be hardly any bacteria living in there at all. The walls of the small intestines are not designed to handle a bacteria colony. If you have a bacterial colony growing in your small intestines, it's called SIBO, small intestine bacterial overgrowth. This is a very significant source of inflammation. It's also a very common thing. If you just get bloated regularly after eating, you quite probably got some bacterial overgrowth in there. Cause the small intestine walls to become more permeable and leaky. This allows two things to pass through. Firstly, half-digested food molecules, foreign half-digested proteins that are not part of your own body will leak through, and that's going to trigger the immune system and inflammation responses. And secondly, the actual bacteria themselves can leak through, triggering an immune inflammatory response. This is actually a very common thing that I see in my practice, and I regularly ask people to put other parts of their treatment on hold until we've spent at least a month or 6 weeks or so breaking the back of the SIBO so that it's eliminated. Now, what you've got to do to eliminate SIBO, I'm going to do a whole video post and a few web pages on this. I've put a lot of work into this over the years. You can take antibiotics that disperse themselves in just the small intestines and don't kill your large intestine bacteria to kill the SIBO bacteria. They're very expensive, or you can use herbs, which is what I use because I'm a natural medicine practitioner. The problem with using a strategy that just kills the bacteria is the SIBO will just grow back again because there's a mechanism that has to be activated, which is called migrating motor complexes. The small intestines, a few hours after you've eaten a meal, will make these gurgling sounds. If you've ever skipped a meal and you've gone too long without eating and you hear your stomach rumbling, those are these large, strong contractions in the small intestines where it's squeezing itself clean. After you've eaten a meal, all the goodness is absorbed within a few hours from the small intestines, leaving behind just a pulp of the fiber that you should be eating on a healthy diet, a high fiber diet. Now, that fiber should not linger or persist in the small intestines for any length of time. As soon as you've gotten the goodness out of that meal, the migrating motor complexes should sweep away that fiber, sweep it down into the large intestines where the bacteria there will have a good feast on that fiber, and the walls of the large intestines are designed to cope with the bacteria, and those bacteria are then going to turn that fiber into all sorts of wonderful chemicals for you that have anti-inflammatory and neuroplasticity boosting effects. If you don't reinitiate and establish good, healthy migrating motor complexes to clean up the small intestines and sweep out the residue of the previous meal. And I have another brain training technique to reactivate healthy, self-cleaning migrating motor complexes. Once you've done all that to kill the bacteria and eradicate the SIBO, you then switch over to the diet that you ultimately want to be on, which is going to bring me to my next part of the body, which is a diet super high in fermentable fibers. So moving down from the small intestines now to the large intestines, if you want to reduce inflammation in your body and improve your neuroplasticity, you should be eating a super high fiber diet for several reasons, but two in particular. To boost neuroplasticity and reduce inflammation, you want to eat a lot of colored plant foods that are called polyphenols and flavonoids in particular. And you can't eat polyphenols and flavonoids without inherently eating a lot of fiber. The flavonoids and the polyphenols are attached to the fiber. So you have to be able to get to eating a high fiber diet, and you may have to go through eliminating SIBO to do this. Another thing with a high fiber diet is it feeds this big colony of friendly bacteria, and then what you want to do is impregnate your colon bacteria with Lactobacillus reuteri and rhamnus, because these have anti-anxiety, sleep enhancing, stress resilience enhancing effects. They make GABA in the large large intestines, which can actually travel up the vagus nerve and have an effect on improving our resilience to stress. So that concludes that bit. There are other things, but I think that should give you a pretty comprehensive idea about the way you should be looking at your body and the types of things you should be thinking about to eradicate all sources of inflammation that are undermining your neuroplasticity. And here's a really important key point. My personal experience is if you leave just one source of inflammation in place, you could be right, get every other thing right, but just leave one. That might undo the whole thing. The expression, a chain is only as strong as its weakest link. You know, all the other links are super strong, but that just one weak link, and it won't work. To have good neuroplasticity, you also have to not smoke. You cannot have any deficiencies of vitamin D3, B vitamins, B12, which is just very common, magnesium, zinc. You cannot consume a diet that contains a lot of omega-6 oils. That's like vegetable oils, which ramps up inflammation, and have an inadequate supply of omega-3 oils. EPA specifically is anti-inflammatory and neuroplasticity boosting. If you want to get rid of nitrosative stress and oxidative stress, you cannot eat a clean diet. There are some supplements that can do that, but a good clean diet, very, very high in plant-based polyphenols and flavonoids, those are the colored compounds in plants, will kind of take care of that. If you're overweight, particularly if you carry internal visceral fat, that's not the fat that's between the skin and the muscles, that sort of external layer of fat. It's the internal fat in the organs and around the organs. That internal visceral fat is a significant source of inflammation. We used to think fat tissue was rather inert. We now know it's not. One of the good things you might like to hear, though, is that the first fat to go when you start losing weight is the internal visceral fat. The body eats that out first. It actually really doesn't want it to be there. And connected to internal visceral fat, another thing that you have to eliminate is if you have type 2 diabetes and insulin resistance. You may think that once you've developed type 2 diabetes and insulin resistance that there's no way back from that, but that's not actually the case. In 2010 it was shown that if you undergo a radical reduction in internal visceral fat and actually overall fat, that you can reverse type 2 diabetes and certainly reverse insulin resistance. A super efficient way to do that is to switch your diet to a plant-based diet. That diet can roll back body weight. Type 2 diabetes is inherently anti-inflammatory, lowers cholesterol, it does a whole bunch of things, so do consider that. I reversed insulin resistance in myself actually using a plant-based diet. Many years ago I had gone on to a ketogenic diet, which is for those of you who don't know, it's very high in animal protein and animal fats, and that's saturated fats. At the time, it was the best that I knew to do for neuroplasticity. It does have some short-term gains for neuroplasticity, but actually inflammation levels can gradually creep up on the ketogenic diet. And I'm not saying it would happen in everybody, but in some people, and it happened to me, it can put so much fat droplets inside the muscle cells, it's called intramyocellular lipids, that the fat droplets in there block insulin from being able to work, and then I developed insulin resistance and was on my way towards type 2 diabetes. Over one weekend, I ate out all the meat in my fridge and freezer. I went from ketogenic on Sunday to 100% plant-based on Monday, and it rapidly and completely reversed the insulin resistance, and I was pleased to discover that I could achieve at least as good, if not, I think maybe better results for my neuroplasticity on the plant-based diet with the right type of supplementation compared to the ketogenic diet. It's also better for the environment and costs a fraction of my previous food bill. I don't actually insist that all of my patients go onto a plant-based diet, because you certainly can achieve great neuroplastic improvements as long as you keep super high vegetable intake. You can have the animal produce on this side, but for those of you who wanted to go that extra bit to lower blood sugar, cholesterol, drop body weight, reduce inflammation, and actually also save so much money on your diet that you could basically afford the therapy, then the plant-based diet is a great option, even if you only did it for a while. Okay, moving on. I know this is a long video, but it's actually a really big subject, and it's an important subject, this horrible benzo brain situation. And anyway, I hope I'm giving you some value and keeping it interesting. Everything I was saying there was that first important principle of eliminating things that are undermining your neuroplasticity. If you remember, then I also said there was two other basic guiding principles. One was that any remedy you take or any treatment you introduce to the benzo brain should have a heavy emphasis on being neuroprotective rather than just stimulating. And the other was to give the benzo brain assistance in balancing low levels of GABA activity and hyper levels of glutamate activity. Now, actually, those two things, when it comes to remedies, often sort of get done together. So you have remedies like gastrodia, magnolia bark, apigenin from chamomile. They have anti-anxiety, calming, GABAergic-like activities, whilst at the same time they upregulate BDNF production and are anti-inflammatory and therefore neuroprotective. And then in addition to that, when I make a balanced prescription, I'm going to include other additional remedies, which maybe don't have so much of a GABAergic or anti-anxiety effect, but are nonetheless boosting BDNF and neuroplasticity and reducing inflammation, pulling the brain sort of away from an unhealthy state back into a more healthy state. And I'm going to put all of those together at the same time with some obligatory supplements, such as you're going to need a B complex and some magnesium and some vitamin D. And I know that the benzo forums are full of those remedies can be stimulating and bad stories and so forth, but they are obligatory remedies to eliminate the possibility of deficiencies in those substances, and not just eliminate deficiencies. People think nutritional medicine is all just about, well, you identify nutritional deficiencies and eliminate them. We don't just do that. I'm sometimes not interested whether a person's actually deficient of a nutrient. I'd look at what does that nutrient do in the body, and I want more of that. A person may, for example, not be deficient of vitamin C and vitamin A and even vitamin D, but I want to boost their immune system. And those three things will do that. So I just want to push those up to the maximum, up just within safe levels, obviously. Now, in the benzo brain, I'm not necessarily saying we're going to push things up to the maximum levels, but we have to have them in there to make sure there's no deficiencies, and we might want to enhance them, but we're going to need to help the brain to control any stimulating effect from those. Examples of nutritional supplements that you might want to push in the benzo brain would be zinc. Zinc is antioxidant and boosts BDNF and neuroplasticity, so it fulfills the neuroprotective status. And then it has a property that we want, which is when you have a lot of zinc in your system and when you discharge glutamate into a synapse, and remember the benzo brain's got too much glutamate activity, if there's a lot of zinc, it shortens the lifespan. When glutamate is discharged, zinc should be present to reabsorb, stimulate the reabsorption of the glutamate out of the synapse to reduce the lifespan of the glutamate and how long it persists and acts. The bipolar brain has an issue with excess glutamate levels, and zinc is one of the things that I use to keep a lid on that. Another thing for the benzo brain might be the amino acid taurine. Taurine is anti-inflammatory, neuroprotective, and has a GABAergic but non-benzo-like effect. So it's calming, helping the brain to moderate and regulate its speed whilst also providing neuroprotection. Its particular forte is encouraging the growth of new cells in the hippocampus, which is called neurogenesis. If your situation includes depression and you feel that your memory is failing, that would suggest the hippocampus might be involved, then you should definitely think of using taurine. Now, ultimately, the goal is to get the brain to the point where you can do some really strong neuroplasticity boosting treatments. But in a benzo brain, you can't start too strong. You're going to have to begin gently and build up from there. Begin with introducing some neuroprotective, anti-inflammatory, BDNF boosting remedies. One of the fears that people have is that if they go too quick, how do you know if you're going slowly enough? And if you go too quick, then you could set yourself back. That's where the neuroprotective principle comes in. If you apply a treatment which just stimulates the brain in the hope that it's then going to grow stronger, but without supplying neuroprotective effects, you might just exhaust neurological pathways or cause an overstimulation reaction. By applying a strong neuroplasticity, neuroprotective prescription, if you do cause any aggravations, you can just pull back, reset, and then reapproach it more slowly. If you're currently still on benzos and tapering off them, do go slowly. I shall probably do another video on how to do that, although there's already a lot of information about how to correctly taper. What it's really okay to use, all I'm saying it is, and I do it in my practice, and if you come to see me, that's what I'm going to prescribe, is that you can use remedies to enhance GABA activity and dampen down excess glutamate activity to enhance the brain's ability to control itself whilst tapering off the benzos. And it's vitally important that at that time you do all of those other side treatments I mentioned, reducing stress and so on and so forth. And then once you're off the benzos, that's where you want to think about really going for this accelerated neuroplasticity boosting treatment. You could do some remedies and techniques to boost neuroplasticity while you're still on the benzos. The argument for doing that would be, well, am I not then protecting myself from the damage that they're doing while I'm on them? But actually, I think as long as you're decreasing, then you're kind of taking care of that. Another way that I think of it is you're trying to repair something while it's kind of being broken up at the same time. I just don't think that's very efficient. Perhaps a compromise would be to put in a little bit of BDNF protection to so the brain holds its own whilst you taper down with support. Once you're off it, then you want to invest in some of the top-notch expensive remedies. So finally, I'll say a few words on how you actually boost neuroplasticity. Most of the conversation so far has been about removing things that inhibit neuroplasticity, which in a way will then allow your neuroplasticity capabilities to be improved. But you can also directly boost and enhance neuroplasticity, particularly by stimulating increased production of neurotrophic factors such as BDNF. Now, on the one hand, there is a big stack of supplements that you can take, and you want to take all of them. So you have top ones such as lithium, low-dose lithium orotate. I don't mean the high lithium carbonate. I've got videos on that if you're interested. It's a completely different ball game to taking prescription lithium that can have toxic effects. There's curcumin and a stack of herbs. But it's not just about the remedies. Each remedy will have a slight BDNF boosting, neuroplasticity boosting effect, and so again you want to take a stack of them. But you wouldn't want to rely just on the remedies. There are so many more things that you can do. You want to eat a diet which is super high in polyphenols, particularly the flavonoids. I've got another video on that. The amount of polyphenols and flavonoids that you need to consume to have an effect on neuroplasticity is not the 5 portions of fruit and veg a day, because that's actually too low for the average person. The average person should be on 7. But when you want to optimize brain plasticity, you're looking at about 12 portions, which is a huge amount to eat. So you're going to need a blender. In addition to the foods that you do and don't eat, there's also the timing of how you eat. The practice of intermittent fasting is a superb way to stimulate neuroplasticity. When the brain goes into starvation mode, it stimulates the growth of dendrites and synaptogenesis, the growth of new synapses. So intermittent fasting is very useful and certainly something that I use in my protocol. Then there's physical exercises. These can have profound effects on neuroplasticity, and not all exercises are the same. We're not even sure that strength training has any effect on neuroplasticity. Aerobic definitely does, but super high intensity HIIT, high intensity interval training, has the biggest effect on boosting neuroplasticity. Sleep is very important, so employing several techniques that enhance sleep physiology, the steps that we go through to fall asleep and stay asleep, should also be a priority. A really new neuroplasticity boosting technique is hyperthermia. Yes, hyper, not hypo, not cold water. Really elevating body temperature for a short, safe period of time may well produce more BDNF than vigorous exercise. But it's not like you would drop the exercise. You would do the hypothermia and the exercise and the fasting and the flavonoids and the sleep techniques and a stack of supplements. And it's by having all those things pulling together at the same time that you get the powerful effects. There's no new special magic herb that hardly anybody's heard of and it's only just been discovered in the Amazon. Of course, the indigenous people have been using it for eons, but it's new to us. No, nothing like that. It's about putting together lots of things all at the same time, each one of which has a BDNF boosting, neuroplasticity boosting effect. If you set the conditions right in the brain and give it a bit of coaxing with all of these things, and when I say a bit, I suppose I don't really mean a bit, do I? I mean a lot of coaxing. The brain is capable of sprouting new dendrites, growing new synapses, and regrowing receptor sites to repair desensitized synapses. Now, I know from experience, and I totally get it, that a lot of you are listening to me sort of talking about large numbers of supplements, and that just sounds way too scary. Do remember that the fear threat detection systems of your brain are hyperactive at this time, so your perception of risk is actually exaggerated. Here's a question I often get from people. Can I try the remedies one at a time? To which I have to say, no, you absolutely can't. If I gave you, 10 remedies and you said, well, how about I take one for a few weeks and see if that works? And, I didn't get an effect from that. So then you try the next one and, I didn't get an effect from that. And after many months, you've worked through the whole thing and you think, I didn't get anything from it. Well, no, you wouldn't, because individually, none of those are strong enough to do much. You've got to put all 10 together. Natural remedies are a lot weaker than drugs, which is part of their safety, but part of the downside as well. It's like sort of having a tug of war with rather say weak people. You've got to put a lot, you put one person, you don't get much of a force. Whereas if you stack up 20 people, you get a big force. With natural remedies, you have to put a lot together at the same time in a coordinated stack to produce a strong effect. And as I said earlier, another reason why you don't take remedies one at a time is because you need the combinations to avoid the side effects. One of the criticisms that mainstream psychiatry would make about my practice and what I do, they would say, oh, come on, your natural remedies may be okay for a case of mild depression, but you couldn't treat anything like serious, like let's say bipolar disorder. Well, I have bipolar disorder and it's nearly killed me multiple times, and I don't use any drugs. I refused to, my choice, and I balance it completely with natural remedy. But this is a photograph of the stack of pills that I swallow twice a day, breakfast and dinner. Now it looks like a lot, but I don't care. I love it. I'm completely well, and I remember how bad I used to be. Okay, that's it now. I know this has been a super long video, and if I haven't kept it interesting enough and given you something of value, then right now nobody's watching and I'm just talking to myself. But I really want to wrap this up in a positive way. So, and I'm so sorry if you've got a benzo brain. These benzo drugs can be so destructive. They should never be used for more than about 10 days at a time. If I was injured in my brain, say in a car accident, and I needed sedation, yeah, sure, give me benzos, but not more than about 10 days, because they can so quickly start causing alterations in the brain. Now, what's happened has happened. You are where you are, but there's no point dwelling in the past. If you've got a benzo brain, it's like, what are you going to do about it? So one thing is those forums and the information you get online. Remember that you have a brain that is hyper vigilant to detect threat. and fearful. That's distorting your perception of risk. So think how you manage that brain. If you go online and you get told that there's nothing that you can do, if you find that you come away from the internet and forums and so forth feeling more inhibited and pessimistic about your future, I don't think that's healthy. And I want to give you a positive message. I was helping people come off benzo drugs since the 90s, and my experience is there are things that you can do. You can straight away start doing all of those side things, like you could be reducing your stress responses and cleaning up your diet, ingesting lots of polyphenols and flavonoids, unless you've got SIBO, in which case you're going to sort that out first. Just do all of them. I mean, just floss, even if you think you've got great gum health. Stay proactive. One of the things about the benzo brain and actually anxiety spectrum disorders that absolutely sucks is the way that it makes you fearful about trying new things. And if you don't try anything, recovery can take ages. For sure, neuroplasticity is a completely natural process. Your brain is already trying to recover, but left to its own devices, my experience is the average person will take 18 months to 2 years of horrible pain recovering from benzos, and some people longer. If you want to shorten that, we have this new understanding that we can actually enhance neuroplasticity. Okay, that's a wrap. Your brain's probably exhausted. Mine certainly is. I hope I gave you a lot of valuable information. If I did, please give me a thumbs up or a like, and you can follow me on social media. Visit my website for more information. Anyway, however you do it, whatever you decide to do, I hope you make a speedy recovery. Bye for now.